want to talk to you today about monoclonal antibody therapy. You may have heard this in the news and you may have seen our recent press release. Monoclonal antibody therapy has been granted emergency use authorization. These are investigational drugs that are used to treat mild to moderate symptoms of COVID-19 in non-hospitalized adults and teenagers who are 12 years of age and older and who weigh at least 88 pounds. So it is for those patients who are at high risk for developing severe COVID-19 symptoms that may require hospitalization. These drugs are only used on an outpatient basis, and I'm going to talk to you a little bit more about that. But at this time, we're only offering it in our emergency room after you have been screened by our provider to see if you're a candidate for this treatment. It is not authorized for patients who are hospitalized with COVID-19. So if they're currently in the hospital, they're not a candidate for this treatment. If the patient requires oxygen therapy due to COVID-19, or it is not authorized in those patients who are already on some form of supplemental oxygen, but now have an increased need for oxygen because of COVID-19. It is not authorized for those categories of patients. It is authorized for patients who had mild to moderate symptoms of COVID-19 in adults and pediatric patients. The pediatric patients have to be at least 12 years of age and older and must weigh at least 88 pounds. But it's that category of patients who are at high risk for progressing to severe COVID-19 symptoms and or hospitalizations. So now, how do we define high risk? High risk is defined as patients who meet these particular criteria: severely obese or have a body mass index of greater than 35, or who have chronic kidney disease. Patients with diabetes are considered in this category. Also, those patients who have some form of immunosuppressive disease or are currently receiving some form of immunosuppressive treatment. Other categories for the high risk is if you're greater than 65 years of age, if you're greater than 55 years of age and you have heart disease, hypertension, or COPD, or some other form of chronic respiratory disease. If you have any of those diseases and you are greater than 55 years of age, you do fall into the high risk category. For those pediatric patients, we consider them high risk if they're severely obese or have a body mass index of greater than or equal to the 85th percentile based upon their growth charts. If they have sickle cell disease, the patients who have some form of congenital heart disease or an acquired heart disease. It is for those patients who also have some neurodevelopmental disorders such as cerebral palsy. If the patient has a medically related technological dependencies, for example, a tracheostomy, and also those patients who have asthma, reactive airway disease, or any other chronic respiratory disease that requires daily medicine for control, those pediatric patients are considered high risk for hospitalization or developing severe symptoms of COVID-19. And this therapy would be appropriate for those categories of patients. Now, how is it given? It is given as a single intravenous infusion over 1 hour. It must only be administered, though, in settings where there's a healthcare provider that have immediate access to medications that can treat a severe allergic reaction. So, for example, it is considered an outpatient therapy, but this is not a therapy that will be given in a clinic or as a home health patient. And you must be monitored 1 hour after the infusion. There are some warnings. There can be a hypersensitivity reaction, which included an anaphylactic reaction, which would be difficulty breathing and require some form of emergency treatment because of that. There can be some infusion-related reactions, which would include fever, chills, bronchospasm, low blood pressure, swelling of the mouth and throat, rash, muscle aches, and dizziness. So those are other infusion-related reactions that could occur. I want to finish this by talking to you a little bit about emergency use authorization. We are EUA. We throw that around a lot, assuming that you know what that means. But I want to make sure you understand what we mean when we say emergency use authorization. An emergency use authorization is issued when the Secretary of Health and Human Services declare that there are circumstances that exist that justifies the emergency use of drugs during this COVID-19 pandemic. For example, the vaccine has been given an EUA, or emergency use authorization. This drug has been given an EUA because of the need for it emergently for the use of it during this pandemic. They do look at these drugs in a certain way to make sure it's appropriate to issue an EUA. There must be no adequate or alternative that is approved. Also, they look at the scientific evidence that is available to show that it is reasonable to believe that this product meets certain criteria for safety and could be effective in the treatment of patients during this pandemic. I hope that I've answered any of your questions you might have had about monoclonal therapy, and also I want you to understand what that EUA means and that you should not be afraid of that. That is actually a great process that allows us to take advantage of the science that we have to treat you if you were to become ill during this pandemic. So, thank you.